At this point in the pandemic, nearly everyone's mental health has been tested in some way or another. But what about our healthcare workers? Deanna Falzone joining us to break down what a recent survey has found while hearing from some of the real voices behind those numbers. Good morning.
Good morning to you. Stress, anxiety, burnout, those are all things that we've probably felt in the past couple months, and that certainly includes our healthcare workers as well. But with the stigma that can surround mental health, it can really feel compounded for those working in healthcare. And that's something that really all of us should be aware of.
For me, it's an immense kind of responsibility and gift to be able to help my colleagues and people that are dealing with the COVID crisis every day.
Frank Durant is a board-certified vascular access specialist, registered nurse from Muskegon. He's worked in the healthcare field for about 20 years now.
There's a huge physical toll because we're called to work a lot more hours and cover a lot more shifts. And, there's a huge emotional and spiritual burden now. Unfortunately, this most recent wave of COVID-19 has just been disastrous, for us and for a lot of families out there.
It's a feeling being echoed through the healthcare community. The proof in the numbers from a recent study by Mental Health America.
We've been so concerned about the physical impact of the pandemic on people we're calling our healthcare heroes, but we've unfortunately overlooked or neglected the effect of the pandemic on their emotional or mental health.
93% of those surveyed say they're experiencing stress. 82% say they're experiencing emotional exhaustion. The president and CEO of Mental Health America says this is severe and it needs to be addressed.
We need to be concerned about things like this because these are real effects and they're just not going to go away on their own unless we help people help themselves.
We just kind of take it out on ourselves. We don't take care of ourselves and we just kind of hope for the best and put our heads down and just keep moving on.
But that can only go on for so long.
I'll be honest, the sheer volume of mortality and morbidity that we're seeing, the scars they're always going to be there. I just feel like, maybe we're, like you said, kind of pushing it in a box and bottling it up. So it's about knowing your coworkers and your colleagues and knowing that they're cracking and asking, hey, can I give you a minute just so you can walk away? It's a tough thing to do because most nurses at this point, if they're on the COVID units, they are superheroes and they do have their capes on and they just don't want to be seen as human or fallible.
But they are.
I try to keep it in my head that I am just kind of a simple man and just a human being at the end of the day. I mean, nobody's perfect. And, we all have faults and we all can only handle so much.
And Durant fears the long-term impact this could have.
At the end of almost every shift, without exception, at least this week and last week, there are 2 or 3 nurses that, say that they're quitting, they're done. I hope that means that maybe they're just quitting my hospital and not leaving the profession. But my biggest fear is that this outbreak and the response to it and, how healthcare organizations are treating their staff and, the emotional toll and dealing with so much death, and especially like for new nurses coming right out the gate, that this hasn't done so much trauma that they leave the profession.
It's why the lessons they're learning through this pandemic, not just on the physical health side of this virus, but what changes may need to be made overall is so important.
I think the hope is that we can use both of these things to think about the transformations that we're going to need to have in our healthcare delivery system moving forward as we get through this pandemic. We've learned that I think there are gaps in the amount of care that we can provide to people. There are gaps in the access to care that people have throughout various regions of the country.
To make sure those there to care for all of us, even when they're pushed to their absolute limits, also have the care they need.
My job is so awesome for me, and there's so many gifts to what I do. And if you're out there and you're wondering, man, should I become a nurse, or why would I ever become a nurse? Every day is a gift, and every day you get to help somebody.
Now, while doing this survey, they found there are 4 areas of support that people generally want when it comes to concerns about mental health. First, more information, do-it-yourself tools, engagement with peers, and more of the traditional care and treatment. So having these resources and practices in place that offers quality help in an efficient way is so important, especially right now. For more information, you can check out Mental Health America. They have resources on there. And just a friendly reminder, most of us know someone working in healthcare. And as Frank would say, be sure to reach out to them, remind them that you're thankful for what they're doing, tell them you love them, and give them a break.